dysfunction, not somebody who's looking for a cosmetic implant, right? However, this is also, in a sense, this is also a cosmetic surgery.
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronsky, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Hi friends, Dr. Susie G here, and welcome to another In Your Pants podcast. On today's show, we're talking penis implants. Yep, penis implants. What exactly is a penis implant? What does the procedure entail? What kind of penis implants are there as an option? What are some of the pros and cons of getting a penis implant? Who would be the best candidate for a penis implant? And what are some of the complications that might arise getting a penis implant? We also dive into the topic of, can you use a sex toy for penis implants? Is it easy to damage a penile implant? We go into that and a lot more with our expert guest, Dr. Jonathan Clavell. Dr. Jonathan Clavell is a board-certified urologist and men's sexual health specialist in Houston, Texas. His practice focuses on the treatment of erectile dysfunction, low testosterone, BPH, and Peyronie's disease. He is one of the highest volume of surgeons in penile implant surgery and currently trains doctors both nationally and internationally when it comes to this type of surgery. I learned so much from Dr. Clavell about penis implants and even challenged some of my misconceptions and beliefs around penis implants. So I know that you will get so much from this episode and more. So without further ado, I welcome Dr. Jonathan Clavell. Dr. Clavell, thank you so much for being on the show today.
Well, thank you, Susie, for the invitation. I'm honored to be a part of your podcast.
Thank you. And we're talking about a very interesting, special niche, really, of penile implants. Can you talk to us about what a penile implant is and what that whole procedure entails?
Yeah, and then just like we were just talking a few minutes ago off air, this is a topic that I'm extremely passionate about, and every listener will probably sense that from me. But anyways, yeah, let's go deep into it. So, I mean, to your first question, what is a penile implant? It's simply a device that is placed inside a man's penis to help him achieve a strong erection for penetrative intercourse. There's different types, though. I mean, there's a malleable implant, and there's also an inflatable implant. The malleable implant involves just two rods that a man can just like mold. They go straight into the penis, and the man can kind of like mold to make it straight whenever he wants to have sex, and then he can just kind of like put it towards his side whenever he's wearing pants. It's the most common implant that's used worldwide. Just because it tends to be, it's just because of cost. It's a little bit cheaper than the inflatable one.
Okay.
However, the inflatable penile implant is the most commonly used here in the United States. It's the one that we call, like the surgeons, we call it the Cadillac. Why? Because this one allows the man to have probably the most, the strongest erection that he can possibly get, and also gives him the natural appearance while it's flaccid. So again, it allows a man to have the closest thing to a natural erection. I mean, just think about it. In order for a man to have an erection, he needs to get blood. He needs blood to get inside the penis and stay trapped inside. So when there's ED, he's either not able to get blood inside the penis, or the blood is not able to stay trapped inside. So this implant goes inside And inside those faulty chambers that are not filling up with blood, and instead of filling up with blood, we're just filling it up with saline. It's just saline water that we're using instead of blood. It contains 3 parts. It has 2 cylinders that are inside the penile shaft, and that's what gives the man the erection. There's a pump that's inside the scrotum that the man can squeeze. And I usually joke, it's like those Reeboks that we used to wear in the 90s.
Yes, yes, I remember those.
So they just have to pump that up. And it usually takes them about 30 seconds to a minute to get an erection. Again, everything's inside, concealed inside the body, so nobody will be able to tell that they have something there. And the last part of that inflatable implant is a reservoir. And we usually place that deep inside the man's pelvis or underneath the abdominal muscles. And that's what holds the fluid. And it's basically a hydraulic system that's transferring fluid back and forth. And again, everything is concealed inside the body. Therefore, it is very likely that almost no one will be able to tell that a man has an implant.
Oh, that's fascinating where technology has come to, no pun intended there, how far we have come for technology and to be able to, do such wonderful surgical procedures to help improve the quality of life for people. And speaking of quality of life, I can't imagine that, the surgery is, it seems very involved, and also who would, because it's so involved, and I can imagine you can't go back. Is there a possibility to go back once you have the implant? And yeah, I think I'm getting at complications. Who would benefit? When do you make that decision to get a penile implant? What's that conversation like in your world?
I mean, it's very simple. Because again, just first of all, like just let's say like who's a candidate for a penile implant? Like, candidate for a penile implant is somebody who has erectile dysfunction and has at least failed oral medications. So as opposed to what many people think, or they used to think, that the penile implant is the last resort, because yes, there is no going back in a sense, but we know that it's actually the best resort. And according to the American Urology Association guidelines, which state that basically once a man fails oral medications, like the phosphodiesterase 5 inhibitors, commonly known as Viagra, Cialis, Stendra, Levitra, all these medications, once the man fails those, all options are open. And that's the conversation that I usually have with my male patients. Like, hey, have you tried pills? No. Well, I'm not gonna offer them the penile implant first. But if they have already failed the penile implant, all other options, like all doors, are available for them, and they choose whatever they think is best for them. Again, the penile implant is not considered the last resort anymore, because beyond the pill, we know for a fact that it's actually the best resort. And then when we say the best resort, it's the one that yields the highest satisfaction for both men and their partners. However, when you say, to your comments, like, oh, well, there's no going back. And usually my conversation with the guy is like, okay, if you're really considering the implant, it's because you're not happy with your sexual life. You're not happy with the way that you're able to maintain an erection. I mean, you might be happy with your sexual life, because again, we all know there's multiple things that we can do for sex, right? So sex is not only penetration. But if a guy is not happy or satisfied with his ability to gain or maintain an erection, those are the guys who are considering a penile implant. So when we say there's no going back, think about it. I mean, let's be honest. What are you going back to? Failure. Is it right? When you're considering a penile implant, it's because you feel like your erections are failing, for you. So usually my conversation is like, hey man, you might have everything to gain and not much to lose whenever you're considering the penile implant.
That's very interesting. I'd like to unpack that a little bit more, because and I hear what you're saying as far as, yes, like there's these advantages of, you're struggling sexually with, erectile dysfunction. And you had mentioned that if the pills aren't working, then this would be a viable option. Now, where does other factors that might contribute to erectile dysfunction come into this conversation? So, for example, what about psychogenic ED, or social cultural factors? More of the biological, I'm hearing that, but also the psychosocial factors that contribute to someone's erectile difficulties and things. Like, where does that come into the conversation, if it does at all?
No, it definitely comes in at all. I mean, if I have a guy who's 25 years old and he's coming in, it's like, I want a penile implant. I mean, I'm not going to tell them straight off the bat, it's like, oh, yeah, let's do it. I mean, we need to have a conversation with a guy because we know that usually for younger men and also for older men, it can happen. Psychogenic ED is a real thing, like, right? Like stress. I mean, you need to be completely relaxed for your pelvis to relax and blood flow to get to your penis. If you're stressed out, if you're thinking about something else, if you're thinking about your penis and not your partner, you might be psyched out, right? A very good friend of both of ours, Dr. Rachel Rubin. I mean, she usually says like, hey, you can be in a 5-star hotel with with your ideal partner, your sexual fantasy. And if you have a tiger in the room, all you're going to be thinking about is that tiger is going to eat me, right? Yeah. You're not going to be thinking about being relaxed and having sex. And that usually, again, that's what psychogenic ED usually entails. With a man who has psychogenic ED, I would be very, very cautious of offering a penile implant because, again, that's a guy who might benefit from other specialists like, psychotherapy. Hey, let's try to debunk all the myths that you might have about sex, about an erection. We have to dig into their religious beliefs or their cultural beliefs just to make sure that we're doing what's right for them. That being said, I remember I once had one patient, right? Like he was married and he was having problems with erectile dysfunction. And he had tried two, clinical sexologists they were trying to help him out. He went to physical therapy. They were trying to help him out and he was still not able to keep an erection. He's like, doc, this might be in my head, but I cannot keep sex in my marriage at this point. And my wife is about to leave me. And if I have a guy who's in that type of situation, I'll be like, who am I? I mean, if he already knows like all the options, he knows all the risks. And my train of thought was like, who am I to hold back something that might be the solution for this guy? And again, this was an exception. This is not the norm. But the guy, again, we placed a penile implant and the guy's like, doc, you helped me restore my marriage. And the guy's super happy with it. And he's barely 30 years old. So again, this is something that has, the penile implant. Yes, it is not the first resort for any type of erectile dysfunction, be it psychogenic, hormonal, neurological. It could be, vasculogenic. Again, even for those who have vascular diseases or a vasculogenic reason to have erectile dysfunction, that is not the first resort, but it should not be the last resort either. They don't have to go through vacuum erection device therapy. They do not have to try injection therapy if they really do not want to. They don't have to do, shockwave therapy, all these other treatment options. Like once pills fail for vasculogenic erectile dysfunction, the penile implant could be an option.
Okay. So do you, as far as that conversation goes, I'm assuming that those options are put on the table or at least given to the individual so that they can make the best decision that is for them.
We, as surgeons, again, as urological surgeons and sexual health specialists, like I will never push a patient to get a penile implant unless it's a guy who's already tried everything. And I'm like, dude, I mean, you just have to make the choice. And I'm not here to push you to make a choice today, but you're at that point. I mean, if you have a guy who has, again, vasculogenic erectile dysfunction, he might have already a penile Doppler duplex ultrasound that reveals that he has a problem either getting blood flow inside the penis or keeping the blood trapped inside. And he's already tried injection therapy, and the injection therapy is not able to give him a good enough erection for penetrative intercourse. That's a guy who I tell him, is like, hey, man, you have nothing to lose. Worst case scenario, you're just going to be just where you are right now. But if you have a guy who's tried the pills and he hasn't tried anything else, I most definitely tell him like, hey, these are all the options that have been approved, are recommended by our societies. The American Urology Association, and also the Sexual Medicine Society of North America. So all these societies, what they do is I tell them, hey, you have 5 options. You have pills, you have the vacuum erection device, you have injection, you have intraurethral suppositories, and you have the penile implant. Shockwave therapy, the P-shot, People are injecting Botox for these things now. And again, right now, those are still considered experimental. At times, if you have the money, you can do it. I mean, I don't recommend it unless we have like better research studies, proving these treatments. But again, all those options are available for you. You decide what's best for you.
Okay. So is there a person who maybe a penile implant would never be an option? Like who would those people be where that isn't an option, or if that's even a thing?
I'll answer that. This is usually why I tell my patients: as long as you have a penis that's attached to your body, we can place an implant. Again, a penile implant is a viable solution for any male who wants to have an erection, a strong erection. It can work.
Okay.
I mean, unless your penis is damaged and you don't have an penis, but as long as you have a penis that's attached to your body, we should be able. And I say that because I once had a guy he had like multiple surgeries in his urethra throughout his lifetime. And when we went to examine him, he had the penis, but it was just skin. Like everything was kind of like separated away from his body. I'm like, well, I cannot place it.
The tissue was fragile, it sounds like. Yeah.
I mean, this is like an anomaly. So that's why it's like, as long as you have a penis that's attached to your body, you are a candidate for the penile implant.
Okay. And so I'm assuming that for those who might have difficulty with healing, like some, immune issues, or as you're saying, the tissue fragility, or just not being able to for the body to take on the implant, I would assume that is a conversation that.
Yeah, I mean, but those are very rare situations. And I've had guys who are, for example, on immunosuppressive therapy, that they're on chemotherapy, for example, or they might be like a methotrexate or some steroids. And yes, I mean, they might have delayed wound healing. But again, it is in the hands of an experienced surgeon. Most of the time, we're able to do it. Right now, I have a guy who's healing from his surgery. I mean, he's probably about 4 or 5 weeks out. And I was the third surgeon he talked to. And the other two surgeons that were like, oh, we cannot do it because you're on these steroid medications. He has rheumatoid arthritis, and he's on both methotrexate and also prednisone. And many surgeons were like, oh, we cannot do this. The same thing happens with guys who, for example, who are transplant patients. They're on all these immunosuppression medications just to make sure that they do not reject their organs, their transplant organ, and we can still, place an implant, and they have done very well. And even with a 3-piece inflatable penile prosthesis, I mean, it is something that we can do. So again, it all depends on, the experience of your surgeon, but these things tend not to be a contraindication for this procedure.
Okay, awesome. Well, thank you for clarifying that, because those are some big questions going up in my mind. So in your opinion, is there any potential disadvantage of a penile implant?
There's only one true disadvantage. And we already, dabbled into this. And again, it's that there is no going back. If for some reason you don't like the implant, we can take it out. But pills or injections will not work once the implant is removed. So again, there is no going back. And again, some listeners might get scared of that, but let's be honest to ourselves. I mean, if you are considering a penile implant, it is because you're not happy with your erections. Your erections are failing you. You want to have sex, but you're not able to either gain or maintain an erection. And you have probably tried another treatment, if not all treatments already. So when we think there's no going back, we need to ask ourselves, like, what are we going back to? Is it failure? Then maybe with the penile implant, we have everything to gain and nothing to lose. I mean, there's another minor disadvantage. That's the one true disadvantage, right? There's no going back. Another minor disadvantage is that the implant, it does not engorge the head of the penis. So if a man has problems getting the glands engorged, the implant will not fix that. And that can sometimes be fixed with pills or a gel. But for example, whenever I see a man who is considering a penile implant, I tell them, whenever we have sex, like, our sexual experience in our penis is the following. We have 5 things. The penis gets hard, right? The head of the penis gets engorged with blood, gets sensitive. You have sensation, right? We enjoy while we're having sex. You have the orgasm, which we know it happens in our brain, doesn't happen in our penis. And we have the ejaculation, which is the fluid that's coming out, right? And I tell them all those mechanisms are different. We're only fixing one. We're only getting your penis hard. We're not getting blood flow into the head of your penis. We're not affecting your sensation because, again, we're nowhere near the nerves that give sensation. We're not going to affect your orgasm. We're not going to affect your ejaculation. So if you have a young man or somebody who has a young partner, and I'm like, hey, we're interested in having kids in the future, the implant will not prevent you from having kids in the future. Okay. This is an implant, not a transplant. It is still your penis. It is still your body. We're just facilitating your penis to get hard. That's it. Your penis will not feel dead. Your penis, because I have guys like, hey, doc, what will happen with my libido? It's like if my partner touches me, will I still feel like things want to start? It's like, yeah, I mean, you might still feel warmness in your penis. You might still feel that the head of the penis gets engorged. But the only way you will be able to get it hard once you have an implant is with you. I mean, if you have an inflatable implant, is with you pumping it up. Okay, if you're not pumping it up, it will not be hard enough for penetrative intercourse. But again, all those other things, all those other 4 things, it's still on the man's body.
Okay, so again, that's interesting.
So if you have a guy who has severe cardiovascular disease, for example, he had severe coronary artery disease, or he has some severe vascular issues and he's not able to engorge the head of the penis, that might be a disadvantage for them. So there are some men, for example, that tell me, doc, when I'm having sex, I enjoy it. I'm able to orgasm, but I feel like the head of my penis is cold. And for those men, something that we can do is we can give them a pill. We can give them Viagra or Cialis or one of these medications. Or there's also gels that they can put in through their urethra, and that can help engorge the head of the penis. And sometimes that can deliver blood flow to the head of the penis. So that's, again, there's ways to fix that disadvantage. That's why I call it a minor disadvantage. And another disadvantage is some men think that, again, that the implant can make the penis smaller. So let's talk about that.
Yes, let's talk about that. Okay.
And again, so yeah, I mean, there are reports and there's multiple studies showing that men say that after the penile implant, the penis is smaller. And I truly believe that to not be true. Okay. And I'll explain. Whenever a man gets a penile implant, most of the time, these tend to be older men, men in their 50s, 60s, 70s, 80s, 90s sometimes. And again, these tend to be men who've had erectile dysfunction for a long period of time. Their bodies have changed. So now we're gaining weight. We have a fat pad and we fantasize of what our penis used to be, and we're like, yeah, these are conversations I have with guys. They're like, doc, I used to grab it with 2 hands before, and now I can only grab it with 1. And I'm like, yeah, but you're comparing your 70-year-old penis and you've had erectile dysfunction for 20 plus years, and the last time you had a good erection was 7 years ago, and you're comparing that to when you were 20 years old. And again, the implant, we can only get it as big as to what you bring in that day to the surgery. So the implant really doesn't get the penis smaller. Erectile dysfunction gets the penis smaller. Peyronie's disease, which, by the way, you can invite me another day and we can talk about that one. and Peyronie's disease, again, it's just for those of you who do not know what this is, you might have watched the carrot commercials and people don't understand what the carrot commercials about. It's a disease that can happen within the penis that forms scar tissue, and then the penis is not able to stretch, and that can cause shortening of the penis. It can also cause deformities or curvature in the penis. But anyway, so these 2 conditions are the ones that usually cause the penis to shrink. The analogy that I usually use to my patients is the following: if you go to the gym every single day and you're stretching out your muscle, you're exercising your muscles will grow. If you stop exercising for 6 years and then all of a sudden you want to go back to the gym, your muscles are not going to be what they used to be 6 years ago when you were having those regular exercises. The same thing happens with the penis. When people might think, oh, but doc, I'm not having sex every day. How did my penis stay healthy throughout my first 30 years? Well, as we sleep, we have nocturnal erections, and that's how how our bodies keep our penises healthy. And once we start having vasculogenic erectile dysfunction, right? Not the psychogenic, but the vasculogenic erectile dysfunction, once we start having that, we start lacking those nocturnal erections. We're not having those regular stretches as we, like we used to have at night. And therefore, our penises can start decreasing in size. Okay. Mm-hmm. So what can a man do in order to regain or try to recover that size before they get an implant? That's when a vacuum erection device comes into play. And usually what I tell my patients is the following. It's like, if you've had erectile dysfunction for a long time and you are really concerned about your size, one thing that you could consider is using a vacuum erection device every single day, probably for at least 3 to 4 weeks before your surgery. And we're kind of like training your penis for its marathon. You cannot go to a marathon without training. And what I tell them is like, hey, we're going to get your penis to boot camp, and then we're going to try to get you, and then the day of the surgery will be your marathon race. The other thing that we as surgeons, at least, many experts, what we do now, in order for us to give men their best, size, right? The biggest size that they can possibly get, is we try to induce an erection right before the surgery. So the first thing that we do before, like this, at least me, the first thing that I do whenever I do a surgery is I will stick a needle inside the penis and I will start infusing with saline just to stretch the penis out, right? Because most men, we are growers, not necessarily showers. So we want that penis to grow as much as possible. And while it's on stretch, that's when we place it on traction, and that's where we make our measurements. And that's the way that most of us are able to keep the size with the implant. The other thing that needs to be, now that we're talking about size and penile implants, is that most men, whenever we measure our penises, we always measure our penises whenever we are erect. Right. So like we discussed before, the implant does not engorge the head of the penis. So whenever the guy wakes up and he, takes the bandages off, the first thing that they do is stick a ruler and try to measure it. Right. So what I tell them is like, hey, whenever you do that, you have to take into consideration that we're not accounting for that glance engorgement. So sometimes I have guys like, hey, doc, I'm half an inch shorter. Like, you shorted me. I'm like, let's talk when you get aroused. And then usually we talk 2 months later and they're like, you know what, doc, I'm actually a little bit longer and wider than what I used to be. And I'm like, I told you. If men were not satisfied, this wouldn't be something that us sexual, health experts, when it comes to urology, would be offering our patients. I mean, the reason we enjoy performing these procedures is because men and their partners tend to be very satisfied with the results.
Oh, awesome. So, oh my gosh, so many questions for you, Dr. Clavell, so many. Where do I start? So a couple of things that one about using toys, sex toys. Mm-hmm. Are there any no-nos completely? Like, can you potentially damage or hurt the surgery or the inflatable?
Great question. So again, these are two cylinders. Again, we're talking now about the inflatable implant. These are two cylinders that are placed inside the shaft of the penis. And this really doesn't give rigidity to the penis. What gives rigidity to the penis is a sheath that's around those two cylinders. So again, that implant is still protected. And to answer your question, in layman's terms, it's like there's nothing that's off label. There's nothing that's out of the question in terms of what you can experience when it comes to sex. I usually tell men, it's like, you can probably smash it with a hammer. It's probably not going to break it. I mean, I'm pretty sure no one can smash it with a hammer. But the one thing that you cannot do is stick a needle into the penis, right? Because if you stick a needle, the fluid will leak out. Also in the area of the reservoir, also in the area of the pump. So try to keep needles or knives, anything sharp that can stab inside and leak the fluid out. But for example, one of the things that men are concerned about is like whenever we see the, sildenafil, like Viagra commercials, usually there's a comment. It's like, oh, if you have an erection that lasts for more than 4 hours, you have to go to the emergency room. With the implant, that doesn't happen. Right. Oh. So with the implant, I have a patient, for example, who comes in to see me once a year. He's in his 70s and he comes in once a year. It's always right before he goes on a cruise. And he's like, Doc, pump me up to the max because you can get it stronger than I. You have a stronger grip than I do. And we pump him up to the max, and he keeps the erection for the full week, believe it or not. So again, we do not encourage that, but this is something that you can have sex for how long you want to. You can reach orgasm 3 times and will be able to continue. Because again, the one thing that the one benefit that the implant will give a man who has one is that you have complete 100% control of your erection. You get it hard when you want to, you get it down when you want to. Those days that you're having sex with your female partner and she tells you, I was this close, that's not going to happen anymore. You can continue going at it even if you reach orgasm. So that's why both men and their partners, again, be it female or male, it doesn't matter, but usually both men and their partners are extremely satisfied with this.
Oh, okay. So my second question then is you're mentioning arousal. So there's mental arousal or subjective arousal and then genital arousal. I did hear you say that, okay, once the implant is in there, it really just the function is the hardness, right? Which is going to be more of a mechanical process. Does that person's physiology in relation to the erectile process, is there any synergistic or complementary assist with in the implant, or does that completely go off the table?
So again, it all depends on, I mean, the arousal process again starts with the brain, right? We get aroused at the level of the brain, and then there's, signals between the brain, your spine, the blood vessels, and the penis. So again, that connection is probably not going to happen because again, you're not having blood flow to bring in, I mean, you're still having blood flow to get inside your penis, but it's just not hard enough for you to get it to penetrative intercourse. But all the arousal process will still be intact. I mean, you will still be, if you have a high libido, you will still continue to have a high libido. If you have a low libido, you will continue to probably have a low libido. Again, this does not affect libido. This does not affect sensation most of the time. This does not affect orgasm most of the time. I mean, I have some men who tell me, Doc, it takes me a little bit longer to reach an orgasm. And usually it's that, again, when the penis is like super, super hard, sometimes you lose some sensitivity because the nerves are being stretched out. Okay. That's why, for example, guys who have a 60 to 80% erection is still strong enough for them to probably have sex. But sometimes they tell me, say, hey, Doc, I have a little bit of premature ejaculation. I used to last anywhere between 5 to 10 minutes, and now I'm lasting 2 minutes. And it's usually because, again, the less rigid the penis gets, the more sensitive it can sometimes get, and you can reach an orgasm a little bit quicker. The other thing is, with age, sensation decreases. So I have many men who are in their late 70s or early 80s, and they have the implant. They're like, hey, Doc, it takes me a little bit longer to reach orgasm. I enjoy everything, but it takes me sometimes 15, 20 minutes or 30 minutes to reach an orgasm. And what we do is we try to find ways, be it with vibrators, be it with medications to help with gland engorgement, or sometimes even medications that can work at the level of the brain to actually help them improve their arousal and hopefully be able to reach an orgasm. So again, all these other mechanisms are completely different. So those should still be intact. The arousal will still be there. We're just helping you to be able to get an erection. That's it. We're not doing anything else.
Okay. So how often do folks who have prostate cancer, prostatectomies come for the penile implant? Because I can imagine that's one of the biggest, I would say, downfalls of having potentially a prostate cancer treatment is the detrimental effects on sexual function. So
definitely. I mean, this is a specific population that I'm very passionate about helping. I did my subspecialty training, like my penile implant surgery training. Most of it was at MD Anderson Cancer Center here in Houston, Texas. So it was, for me, I was super honored to be able to help all these guys who have prostate cancer. So yeah, I mean, erectile dysfunction is a very common side effect of radical prostatectomy, right? Whenever the prostate gets removed, and also for radiation, and also for guys who have they're on a hormonal therapy to keep their prostate cancer under control. So again, therapies for prostate cancer can definitely affect the erectile function of a man, and this is a very high volume population who gets these procedures. Usually what I tell men is, again, if you had good, strong erections before your prostatectomy, it's like, hey, and you had a nerve-sparing prostatectomy, sometimes those nerves can recover. There is good research data showing that after a year, that tends to be less common for it to be able to recuperate. So in the first year, I tell them, like, hey, it's really up to you. You can wait. You don't have to jump the gun and get the penile implant right away. We can try other ways to rehabilitate the penis. We call it penile rehabilitation with a vacuum erection device, with pills. We try to give them injections. And the good thing about the injections, again, the injection bypasses all that mechanism that was disrupted by the surgery. So the injection goes directly inside the penis, will bring blood flow directly inside the penis, and the guy should be able to have an erection with the injections after the radical prostatectomy, if they had good erections before. So just like with any other man, I tell them, like, hey, these are all your options. You decide what you think is best for you. It all depends on your level of urgency. Just yesterday, I was having a conversation with a guy who he had his prostate removed back in April. So it's been 7 months. He still hasn't recovered. His nerves haven't recovered. He still has erectile dysfunction. He's like, doc, I want to wait because I've been through so much in the past year. And I'm like, let's wait. I mean, we can try the injections for now. Let's see how you do. And whenever you're ready, I'm here for you. Again, we're not here to push therapies to a patient. We're here to facilitate the tools that we know that can help them. And the guy, I mean, this is purely elective, so the guy decides whatever he wants to do. But to answer your question, because I get carried away.
No worries.
So to answer your question, I mean, guys who have radical prostatectomy are excellent candidates for this. There are excellent candidates for this. And they can still, reach orgasm. Their orgasms will be different, right? Their pelvic floor has been altered whenever they removed their prostate, so their orgasm will be different. They're not going to be able to ejaculate. There are some men that say that their orgasms are more intense after their prostate gets removed. And I think it's probably from some changes in their pelvic floor muscles, right? And there are some men who sometimes can have pain whenever they have an orgasm. And that's when experts like yourself can come in to to help them be able to reach a satisfactory level of sexual pleasure.
Yeah, no, that's wonderful. Thank you for sharing your passion. And so this got me thinking about another population which may or may not be, part of your wheelhouse, but for those who are transitioning, gender affirming surgeries, phalloplasties, where does the penile implant come into play for those types of surgeries?
So, I mean, that is not completely out of my wheelhouse. But yeah, I mean, for basically any, woman who's transitioned into a man, or any trans man who wants to achieve sexual intercourse, the penile implant can be done. It's not as straightforward of a procedure as with a guy who, as a natural man who had an erection, or who has a penis. With two chambers, because again, given that whenever they have a new phallus, the chamber inside that phallus is different, right? This is something that they usually get it from the forearm, and we need to create that chamber. So instead of placing two cylinders, most of the time what we do is we place one cylinder and we try to anchor it, to the bone to make sure that it has enough axial rigidity for them to be able to achieve intercourse. But yes, we still use the inflatable implant. At least I've never seen a malleable implant placed on a trans man, but it is definitely still possible if they want to achieve sexual intercourse.
Okay, awesome. Thank you for answering that question. So what should someone look for when choosing a potential surgeon for a penile implant?
I mean, that's a great question, and something that's probably a little bit hard to answer, right? But usually, what I tell men who call our office is, I mean, to be honest, my most honest recommendation would be to look for someone who you trust. If you do not trust your surgeon, that is not a good way to start. I mean, look for someone with experience, ideally, right? I mean, don't always take the easy way out. I get many patients who went with a local urologist that was the closest to them, that the urologist even tells them, like, hey, I don't feel comfortable doing these surgeries. I mean, I've done them before, but I would recommend you to go to someone else. And they're like, oh, no, doc, I mean, you're my doctor. And I want you to do my surgery. And they're like, okay, I'll do it. And then once they do it, they're not happy. They're not satisfied. And then they come back to see me for me to fix them, right? And usually the first surgery tends to be the easiest surgery, right? So usually, again, I would say try to look for somebody who has experience. I believe that it is not out of the question, or it's not disrespectful for you to ask your surgeon how comfortable he or she feels doing the surgery. I mean, you can ask them, how many have you done in the past year? How many have you done in this month? How many do you do a year? Because again, sometimes we'll have a surgeon who's like, oh, I've done 500 of these, but the last one was 10 years ago.
Yeah, good point.
So try to find somebody, again, who you trust. That's probably the most important thing. And try to find somebody who feels comfortable doing this. Like, I have guys who I treat other conditions in urology. And I have guys who sometimes come in and say, hey, doc, I mean, you diagnosed me with prostate cancer. I want you to take my prostate out. And I'm like, sir, if I was you, if you were my father, I wouldn't trust myself taking your prostate out. I know I can do it, but it's just been so long since I've taken a prostate out, that I believe that the best thing for you is to find somebody who does this on a regular basis, and that way you can have the best outcome possible. Because yes, the penile implant is a functional surgery, right? This is not a cosmetic surgery. I've had guys who come in and they're like, doc, I just want to be able to last longer. I want an implant. I'm like, that is not the right candidate for this. This is something, a procedure that we offer for men who have erectile dysfunction, not somebody who's looking for a cosmetic implant, right? However, this is also, in a sense, this is also a cosmetic surgery. We want to give, guys are very jealous about their penises, and we want to give them the best outcome possible so that they can feel comfortable and finally be able to, instead of focusing on their penis and being worried about their penis failing, they can focus on their partners, they can focus on their relationship, they can regain that confidence. I mean, usually what I tell guys, what we try to do is try to provide hope for them. We try to get guys who feel hopeless, we try to get them to be hopeful. We want them to feel worthy of their relationships. And we want them to kind of like stop thinking about their penis. We want them to feel like when they were 20 years old. And sometimes I have couples who are in their 70s and they're like, doc, I feel like when I was 30 years old. Again, not physically, of course, but mentally, emotionally with their partners. Now it's like, doc, now we can actually focus on each other rather than having 20 minutes to focus on the penis for it to start working, right? So yeah, when it comes to looking for a potential surgeon, look for somebody who you trust, somebody who feels comfortable, somebody who's very well familiarized with not only how to perform the surgery, but also how to manage complications. We didn't even talk about complications today.
No, but we can briefly if you want to, because I actually did have a question about expectations for healing. So after you have the penile implant, what is the guidelines for the healing process? And does there need to be any rehabilitation around that afterwards?
So, for the actual surgery, I mean, and just to finish that surgery, try to find a surgeon who again feels comfortable not only performing the surgery but also managing complications, right? Because again, if something goes wrong, you want to make sure that you have somebody who you can trust to take care of whatever happens. And again, usually there's multiple. There's probably hundreds of experienced surgeons, at least here in the United States, because sometimes I have guys like, doc, there's only 3 surgeons and you're one of them. Like, no. I mean, there's multiple surgeons around the United States who feel extremely comfortable performing these surgeries and also managing complications. It's just a matter of just trying to find them, and again, find somebody who you trust. Now let's talk about the complications.
Yes, please.
Ask me the question again.
Yes, please tell me, what are some of the complications that may arise from a penile implant surgery?
So, I mean, when it comes to complication, the most common risk that can happen is infection. In the hands of an experienced surgeon, this risk is usually less than 2%, meaning, again, 98% of men do not have any infections. There are many surgeons out there that have their complication, that their infection risk at less than 1%. So again, and how do we prevent these infections from happening? Again, we make sure that we're completely sterile during the field. These implants now have antibiotic coating, or they have, one of them has an antibiotic coating already installed in it, or impregnated in it. The other implant has a hydrophilic coating that is able to absorb solutions and antibiotic solutions and antibacterial solutions, and we can install the implant while it's already coated with that antibiotic solution. And yeah, I mean, usually, again, that's probably the most common risk or complication. But even after an infection, there are ways for us to be able to restore an erection later on. Also, the device can fail. I mean, this is a medical device. So if you are young and you're getting an implant, this will very likely fail at some point. Most implants last between 10 to 15 years. But I've seen implants that I've seen guys who've been 18, 19 years out with their implants and it still works. So again, and I've also seen guys who fail within a year. So again, this is usually, I tell guys, it's like a car. Like, you buy it brand new and you can get an amazing car that will last you for 20 years, and you can get a lemon that will last you for 6 months. It also depends also in wear and tear, right? So if you are extremely active with the implant again can probably last a little bit less than a car that you're only driving once a month, right? So the device can malfunction, and also the device can be misplaced, which is why it is important that men seek help from an expert. Because sometimes the implant can be undersized, it can be oversized, sometimes it's not placed in the right position, and then the implant can kind of start like poking towards the side. So that's very important that you seek help from an expert, right? Rather than go to somebody who's not experienced performing these procedures, because that's how we can avoid these complications. However, all these things that I talked to you about, for example, if the implant fails, that it malfunctions, that it stops working eventually, we can always go back and replace it with a new one.
Oh, okay. And the tissue around the implant
depends, right? So sometimes the tissues with time, I mean, sometimes the tissues can get weaker and weaker, but again, most of the time in the hands of a well-experienced surgeon, we're able to get something in to be functional. Okay. It's probably not going to be as, the tissues are not going to be as healthy like the, 3 months out of your first surgery, right? But I've had, for example, probably about 6 months ago, I had a guy who I did his 10th revision. And it worked. So again, there are some surgeons who, there's one study that says like, after the 5th implant, everybody gets infected. Like, that's not going to work. That's not true. So again, I did a 10th revision on a patient who's still functional and he's still very happy.
Wow, this is awesome. This conversation, I swear you're right. We could probably talk for 3 hours on this stuff. So, okay, I promise. Last question.
No, again, I have all the time that you need.
So healing. Let's talk about expectations for healing timeframes. Is there a ramping up process of using the device? Like, what is this conversation like with your patients?
So usually the recovery, I tell guys, is usually between 3 to 6 weeks. I mean, there are surgeons that are able to get their patients to start using the implant for sex at 3 weeks. So the way this works, again, we place it, if we're talking about the inflatable implant, right? Because the malleable implant, you just place it and you wait for the incision to heal. Once the incision's healed, you use it. But with the inflatable implant, it's a little bit different. So there are some surgeons that will place the implant and we keep it partially inflated for, again, anywhere between 2 to 6 weeks. And then once the patient is able to cycle the implant, that they feel comfortable to both inflate and deflate, they can start exercising the tissues. And by cycling, we mean, again, you inflate it to the max, you keep it there for sometimes, again, it can be 5 to 30 minutes, and then you deflate it.
right? And that's what we call cycling. And that's most of the time what's able to keep the chambers as expanded as possible. Because as soon as we place any implant in your body, except if we place it in your abdomen, but if we place a breast implant, if we place the knee replacement or a hip, your body will create a capsule around that implant. And that's the way the body protects itself from attacking the actual implant. Okay, so there's going to be a capsule that's going to be placed that's going to start forming around the implant. And we want that capsule to be as expanded as possible to be able to maximize the girth for the patient and also the length for the patient. So what we tell the patients, okay, we're going to place an implant. We might leave it chubby. That's what I call it, a chubby. So we leave it like around 60%. So it, expanded enough that it will keep the form and shape of the penis. So it's not going to be like super flat, but not rigid enough that they're not able to get it inside their pants while they recover. So the body will start creating that capsule. And then once you start cycling, we're going to try to expand that capsule as it starts to form. Usually that capsule takes about 6 months to a year for that to form, but most of it forms within the first 3 months. So what I tell a guy is the following: hey, we're going to keep you partially inflated for my patients is usually 4 to 6 weeks. And how do we determine who's 4 weeks and who's 6 weeks? It all depends on the specific guy, right? On the specific patient. There are patients that take a little bit longer. So I tell them, set your mindset for 6 weeks so you don't get frustrated when you're at 4 weeks. But I tell them, so set your mind for 6 weeks. At 6 weeks, we're going to start cycling that implant every single day. Every single day, I want you to get it hard and then deflate it. And you're going to do that for at least 3 months. However, if you're super motivated and you want to really maximize that, continue doing that for 6 months to a year. And what we know, and is very common for guys who regularly cycle their implants, and they usually come back and they tell us like, hey doc, I'm actually a little bit bigger than what I even used to be. The implant kind of like expanded the tissues a little bit more than what I used to have when I had a natural erection. But again, those are the guys who are extremely motivated. And most of the time, whenever that implant fails, or we have to go back for whatever reason, most of the time, we're able to get them a little bit longer. The implant that we can place in the future can be a little bit longer. So again, the implant from the inside can continue to expand the tissues. Healing, 3 to 6 weeks, we just have to wait for that incision to heal. The only things that men cannot do is, usually I tell them 3 things in those 6 weeks. You cannot lift anything heavier than 10 pounds. Why? We have a reservoir that's going to be in your abdomen. And we get that through the inguinal ring, so through the groin. So if the man starts, lifting things that are heavy or creating pressure in their core, that reservoir will migrate down into the scrotum, and then we have to go back and reposition it. Again, that after 6 weeks, the capsule's already, most of the capsule has already been formed, and most time they are able to get back to a regular life. I have guys who are bodybuilders and they have implants and everything worked well. And they're lifting 600 pounds. So they're going to be fine. And then, so that's one thing. The other things I usually encourage my patients to not submerge in water while the incision is still healing. My wife is a dermatologist. So she's like, yeah, you try to keep the incisions, you can keep them moist, but don't soak them. And then the other thing is that I try to discourage sexual intercourse for the first, usually 4 to 6 weeks. There's many, younger guys, guys in their 30s or 40s that get implants. Usually they're able to cycle their implants a little bit sooner. And usually what I tell them though is I try to be gentle initially while you're having sex, because you're still healing from the inside. We want to make sure that the stitches that we place inside those chambers inside your penis, that those heal before you start doing, crazy positions that are going to disrupt your penis.
Yes.
So again, it's very rare for sex to damage the implant. There's no positions that are out of bounds when it comes to this. Everything's game. You can get as creative as you want to, but while you're healing, again, during those first 6 weeks, try to be gentle. Usually what I tell guys is like, hey, the first time you have sex with this, it's going to be like the first time you had sex. You're both going to be like looking at each other, it's like, everything okay? Does it hurt? Okay, no, okay, well, let's continue. And then as you feel comfortable going at it, off you go, off to the races. And you can have a very, very successful sex life.
Oh, that's awesome. Thank you so much, Dr. Clavell. And so my mind has been blown and I have learned so much on today from you. Thank you so much for sharing your knowledge with me and the audience. And I mean, wow, you're a wealth of knowledge and certainly clearly an expert in your field. So how could folks connect with you if they wanted to reach out to you, connect with you on social media?
So we try to be in all social media platforms. The Twitter, I usually use it for networking with other experts. I don't use it mostly for listeners and patients to communicate with me. But certainly through Facebook, I have a Facebook channel, it's Clavell Urology. It's Clavell, Clavell. I'm pretty sure you can get it in the description of this podcast and everything else. Definitely. So it's Clavell Urology. And I also have Instagram and YouTube channels. So Instagram and YouTube is usually Clavell Uro. That's also my Twitter handle. So if you want to find us through there, again, you can always communicate with us. I'm an open book. I try to respond to everybody who posts comments on my YouTube videos as much as I can, as time allows. And again, we want you to feel if you're listening to this and you're considering an implant, we want you to feel as comfortable as you can. I want you to feel at peace. I know nobody initially wants an implant. Most of the time, whenever we are considering an implant, is because we think we need it, right? So I want you to feel at peace with your decision. I want you to be stress-free. I want you to be relaxed. And my goal is for you to feel comfortable and for you to be motivated and for you to be confident again. So yeah, YouTube is, there's a lot of information. You can even watch how I perform the surgeries.
Definitely.
How I fix, complex situations, how I fix curvatures. I'm an open book and you can watch step by step. If you watch those videos, you can probably go into the operating room and assist me doing the surgery. So again, there's a lot of information on how to prepare for surgery, what to expect after your surgery. Now I'm actually working on a video because I get men from all over the world to get these surgeries done. And I find myself kind of talking, answering the same questions about the logistics of traveling. And that's my upcoming video. It's coming hopefully soon. And you can even see patient testimonials. We had a recent video of a couple who kind of shared their experience, both a man and a woman sharing their experience of how their journey trying to get over erectile dysfunction worked. There's so much information online, not even in my channel alone. There's multiple channels out there. If you guys really want to learn more about what men really go through, Boston Scientific, which is one of the companies that make implants, they recently launched a mini docuseries of 5 episodes, 7 minutes each. It's very quick and very short. So for those who have shorter attention span, and it's called the HARD series, HARD series. And you can look it up online. You can put Heart Series, Boston Scientific, or Heart Series Erectile Dysfunction. I'm pretty sure you can find it on Google. And you'll see 5 episodes of 5 guys that struggled with erectile dysfunction because of different causes, right? There's people who had diabetes. There's people who had prostate cancer. For example, my patient in that episode, in the episode that we launched, it was a young guy in his 40s. Completely healthy, but he had problems specifically in his penis, and they share their stories of how they were able to overcome erectile dysfunction with this surgery and how this surgery transformed their sexual life. So again, there's a lot of information out there. I'm more than happy to communicate with you guys, and if you guys want to schedule appointments with me, again, just look up online. You'll be able to find me. We have a website as well. It's very easy to remember. It's HoustonMensHealth.com. So we're in Houston, Texas. So it's HoustonMensHealth.com. But I'm not from Houston. I'm from Puerto Rico. So, but yeah, it's HoustonMensHealth.com. And you can find also a lot of information about these procedures, about me, if you want to see what we've done. Again, I'm very passionate about this topic. I give conferences about this topic. I train doctors how to do these surgeries. And we have men from all over the world who travel to get these surgeries done. And I'm available. I try to help as much as I can, my patients as much as I can, and I'm excited to be a part of this journey for these men who need these procedures.
Oh, thank you, Dr. Clavell. Yes, clearly you're so generous with your time and your resources, and we will make sure to link all of those fabulous resources in the show notes for people and in the YouTube description below. So no worries on that. Thank you so very much again for your wisdom. I have learned so much. So thank you again.
Thank you for the invitation, and I'll be if there's other questions that arise when you post this in your platforms, and we need to give some tune-ups and go back on some topics. I'm more than happy to come back and help you out, because again, my goal again is for people to be educated, and there's a lot of misconceptions out there, a lot of myths when it comes to these procedures, and we need people, right, couples to learn more about these options that are available for them.
Absolutely. Well, thank you again. And to all of our listeners and viewers, thank you so much for being here. As always, in loving wellness for your pelvis, this is Dr. Susie. See ya.
Thanks for listening to today's episode. Be sure to visit my website, drsuzieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.